Hi everyone, good morning. I hope you guys are staying happy and healthy wherever you are watching this. I'm so excited to do a live because, as you know, I very rarely do these, but today I'm here as an ambassador for Go Campaign. And as many of you guys already know, Go Campaign works with grassroots local heroes around the world to address the needs of at-risk and vulnerable children and youth. Through Go, you get to see firsthand the impact of your dollars. And there's no red tape. Go gives you the ability to make real, immediate, and tangible change. And right now, Go is focusing on helping these heroes during this crisis so that the needs of children and young adults are sufficiently met during this challenging time. Go has already given out over $102,000 in small grants around the world to helping local heroes on the front lines, helping them give children and their families access to food, healthcare, and educational resources. One of the recipients of this grant is Go Campaign's local hero, Dr. Rob Gore, who is going to be joining us today from New York City. So bear with me as I invite him on. Yay!
How you doing?
Hi, Dr. Gore. How are you?
Good. How you feeling today?
I'm feeling good. I'm happy to be healthy and here talking to you. It's an honor. I'm so happy to meet you over live. I feel like
we gotta do this in person when the quarantine ends.
I feel like I've heard so much about you and I've read all about your incredible work. So thank you so much for taking the time to be here this morning. I know you're on the front lines doing the most important work. So to take the time to talk to me is so greatly appreciated.
No, I appreciate you guys. I appreciate you. The Go campaign has been really meaningful in helping support our work.
Yeah, can you please tell us a little bit about what it's been like on the ground working for you in the hospital, how KAVI came to be, Kings Against Violence initiative that you started, and what you have been doing during this time?
So I'm an ER physician at both SUNY Downstate Hospital, which is a designated COVID-19 hospital, and I'm also at Kings County Hospital, which is literally across the street, and Kings County is the city hospital. And we've been working with during the COVID pandemic pretty extensively here in Central Brooklyn. Now, like the whole COVID thing. Now, Central Brooklyn itself is famous for having many health disparities. We have higher rates of violence. We have higher rates of new HIV transmission, high rates of high blood pressure, diabetes, and things that really compromise our overall well-being. It also happens to be where I grew up. I went to elementary school right across the street from the hospital. So coming back and practicing has been a huge honor, but also to make sure that the people in our community get quality care. Now KAVI itself was created, and the concept itself started developing way before I even became a physician. Me and friends of mine growing up were like, we want to do work in the community, and we're going to do it with young people. We didn't really know in what capacity, but that was back in college. And then it kind of continued on. And working in Chicago, I was a resident physician at Cook County Hospital on the west side of Chicago. And we were seeing so many rates and so many young people coming in who were injured. And then when I finished residency, I moved back to Brooklyn. The same thing was happening. And what we were really doing was providing more of a Band-Aid approach to young people who were coming in injured. And instead of just treating people's injuries and managing casualties, we had the idea, what if we prevented people from becoming patients? And that was really how KAVI was born. So KAVI itself is a hospital, school, and community-based violence intervention and prevention program that's focusing on just reframing this entire conversation around violence and trauma. Trauma itself is physical, but trauma itself is also mental. And just tying this stuff into COVID-19, and the overall pandemic, I think when people are put in stressful situations, when you are dealing with not even just one stress, but more of a chronic stress situation, it can really compromise your overall well-being. Well, this is stuff that we knew well before COVID-19.
Of course.
And so the pandemic itself has only made it worse. And so the work that we do with KAVI and the other organizations, got to give a shout out to the Brooklyn Combine, who are our partners in crime. I shouldn't say crime. It's probably not the best choice of word.
I got it.
Combine, SOS, Man Up Incorporated. There's so many groups that are out there that are doing incredible work in the community to ensure that we maintain a level of vitality that we deserve.
Exactly. And it's so true what you're saying about the emotional state of not having to go into a hospital because you're stopping the problem beforehand, and being against that it starts outside the hospital. And if you end up having to be a patient, then you have to cure what's there. But if you can help prevent being a patient, then that's where to really start. And obviously COVID-19 has heightened everything going on right now. And your focus for the current situation with KAVI is helping kids in terms of food supplies, transportation. Can you talk a little bit about how, I mean, I feel so lucky to be an ambassador for Go campaign. And, I was, as I'm sure a lot of people have been, sitting at home trying to figure out, how can I help? What can I do to make a difference? You're on the front lines doing incredible work. And so many of us are sitting here going, oh, I want to help, but I don't know what to do. So for me, Go campaign is an amazing place to be able to, go to give money to grassroots organizations like yourself and actually see tangible results. And I feel so lucky that I was able to provide help to you in terms of broadening what you're able to do for kids at this time. So I'm just curious, for people watching that also want to help with Go campaign, to see directly where your help or when one gives money or gives support, like where it goes. Can you tell us a little bit about what KAVI's been doing for kids at this time, and what kind of help kids need right now? Because I feel like kids can sometimes be not paid attention to enough in times of crisis, because maybe they're not the ones being affected as much, whether it's COVID-19 or just in general. If they're not affected by some form of disease, or they're not in the hospital, they're almost thought of, it's not needed to help care for kids, whereas there's so many domino effects with them. So can you speak a little bit about what you're doing for kids right now?
Right. The first thing I want to kind of address is just the concept of the concerned citizen. We all have an ability, both that's cultivated and innate, to be able to help other people who are in positions that aren't as strong as our own. And so, I have a special set of skill sets as an emergency physician. I've been training, doing this stuff. You include medical school and beyond. This is at least 20 plus years, because I've been a physician. This is the 18th year that I've been a doc. But everybody has special skill sets, and there might be education. You might have an ability to be able to transfer knowledge to another person. It might be that you have a gift for acting and be able to use your platform to help reach out and bring light to an issue that is affecting people who are coming from marginalized spaces. I think we all have this ability, but you have to first kind of identify what is the problem that you hope to solve. And in the instance, within medicine, I hope to keep people alive. In the instance of KAVI, we hope that young people can help heal from trauma, particularly those who haven't historically had access to healing opportunities. So like organizations and foundations like the Go campaign and philanthropists like yourself have been in a very unique position to help support the energy and efforts of people who are already on the ground doing this work. Right now, so many organizations right now are shutting down because they don't have the financial resources to keep open. They have the human power to keep things up and running, but without that financial support, many organizations, even grassroots organizations who are on a grassroots level, don't always have the opportunity to keep things up and running. So we want to thank you guys just for the monetary support to keep our efforts. But some specific things that we're actually doing. We on a basic level, we're checking in with our kids. When anybody who's been experiencing any level of trauma, you want to make sure the first question you ask, and even what we do in the hospital as physicians, is, are you okay? You want to ensure that sense of safety first. And safety can mean everything from you are physically protected, but you're also addressing to find out, do they have adequate food? If you don't have food, clothing, and shelter, those are three essential things that we're expected that we need in order for our survival. And so if you don't have the things that are required for your survival, you are not going to be at your best, and you're going to be in a stress state, which further compromises your ability to fight infection. And so with your donations and with the support of the Go campaign, we've been able to obtain a large number of face masks for our kids. We have this conversation all the time with young people and older people about proper social distancing and ensuring that they have protective equipment. And they may not have symptoms, but their parents, their grandparents, their elders who they're staying with can possibly have get an infection just because they're not properly protecting themselves.
Right.
Even New York City is one of the places that we don't have the luxury of staying inside. It's kind of the gift and the curse. When it's summertime in New York,
Right.
everybody wants to be out. But it does make it challenging because people do live in small spaces to maintain that adequate social distancing. It's definitely a privilege to social distance in a place that you have clean air and then you have all the supplies that you need to survive. But that's not the case with a lot of our kids. We have some of our kids who are hungry. Some of our kids have been struggling with making sure they even had Wi-Fi to be able to do their schoolwork. Some of them are struggling because they may have had pre-existing anxiety and they just need some people to help check in on them. So being able to talk to them about their fears and insecurities, being able to provide something like a PPE, because many of them are fearful because they can't go out because they don't have proper gear. And so these are some of the things that we've been able to get support from your campaign and your generous donations. On top of that, we are putting together actual kits, like safety kits, so that people can ensure that they have hand sanitizer. There's no way you can get into a New York City train station without touching something. Making sure that they have even like a pair of gloves. And so our team has been putting together these kits with the support of the donations from Go, so that people can have necessary supplies that are required and essential for survival. Nobody wants to get COVID-19, but more importantly, people don't want to be sick. And I think if you're in a position that you are well, that you are healthy, and that you are at your best, you can function, you can learn, you can help take care of your loved ones who aren't in the best positions possible. That's why we're here. That's why we want to continue our organization and continue these efforts, not just to merely survive or exist. We want to make sure that our communities that we serve can thrive.
Well, thank you so much. It's what you said was really wonderful about everyone has their own specific skill set, because I know I'm not alone in that. We're sitting in our homes, wherever that may be, no matter what industry you're in, and you're just trying to rack your brain about how can I help, what can I do to provide help to those that are in need, either on the front lines. How can I help inspire? How can I help stay sane? How can I help others feel less alone? And it's not just about money. It's just not. It's about emotional support. Like you said, some of these kids, the first thing you ask is, are you okay? I think a lot of us are afraid to admit when we're not okay. And the second that we admit, you know what, there's something wrong, or I'm feeling bothered, or I'm actually really scared, I think the second that we admit to those things and open up, we relate to other people and feel less alone. And self-care, I've always said, is not selfish, it's self-love. And the second that we accept that and allow ourselves to feel and emote, especially during a time like COVID-19, I think that's the first step in getting better. And obviously, the work that you're doing is so important, and I'm so happy to highlight what it is that you're doing. And I'm so thankful that you took the time to join us today and to talk about your initiative. And I hope that more people learning about what you're doing can help Go to Go campaign and help provide more support for you, and just sending you all the love and support and good vibes, because the work that you're doing is truly remarkable. And I'm so honored to speak with you. And it's a pleasure, because to meet someone and speak to someone who's really saving lives out there is a real privilege. So thank you so much for what you're doing.
Oh, thank you. We have an incredible team, both in the hospitals and also definitely with KAVI and all of our supporters. Some people ask us when you follow a kid when they graduate from school, does that mean that you're done with them? And that's not the case at all. We're still following up with our alumni who might be a little bit older, and some in good situations, some not in such great situations. One of our guys who had made leaps and bounds while with us, an active participant in the program. We still follow up with him now. But hard times have definitely come upon him, and he's in a shelter with taking care of his daughter. He has full custody of his infant daughter. And, so we are helping make sure that he gets the food and just basic hygiene supplies that he needs to to be able to survive and best take care of his daughter. We're making sure that we can properly educate a lot of other people who don't have access to the same academic resources or information, because this is going to come back. People always kind of ask, like, oh, is COVID-19, we're going to go back to normal once the pandemic is done. Like, well, this is kind of the new norm in terms of social distancing and just making sure that we can maintain a level of safety and even overall security. And so, people who are coming from communities like our own, who are coming from Central Brooklyn, they're coming from the South Bronx, they're coming from Southside Queens, they're coming from parts of Harlem, they're coming from pockets in Staten Island and all over the 5 boroughs and even upstate New York, don't always have access to the same things that are required for them to survive. And so we want to be in the best position possible to at least be a safety net for them.
Right.
And if we can't do it ourselves, we want to make sure that we can link them up to all the people who have access to resources that we don't. And so, having that family and having that extended family, particularly like with folks like the Go campaign, yourself, is a way that we can continue this work. Because this is only the beginning. If we're going to make a substantial dent, and it's not even just making sure that people have proper PPEs or get a vaccine whenever the vaccine comes out, and the whole vaccine thing, that's an entirely different conversation. But we want to make sure that they are taken care of. We want to make sure that they can live. That's what everybody wants. But things that have influenced our, what we call social determinants of health. And I know it's a public health term that we use, but if there isn't proper economic development, if there isn't proper education, if there's a limited healthcare access, limited social support systems, then, people are going to suffer from these diseases on a level that we've never seen before, which is why we have higher death rates in the Black, Latinx, and Native American communities here in the United States.
Now, is there a way for kids to contact you, or is this all through the hospital? How would kids get help through you, that either whether based in New York or Brooklyn, or is this based just at the hospital and then through that comes to KAVI?
Well, they can check us out at KAVIbrooklyn.org. That's KAVI. I'm going to text it so everybody can see it. They can check us out on our website and get access to information and updates on what we're doing as an organization. But we're also, they can also, if people want to donate, some people want to donate, and we won't turn that away at all.
Exactly, like you said,
it's part of the BrooklynGives.org campaign, and we can text that up on there too. But they check us out at KAVIbrooklyn.org just to find out what we're doing, giving updates. Even email us at info@KAVIbrooklyn.org. Jaquel Clemens, Jack B. Nimble, I just posted our email address for people to get in touch with us. But this is only the beginning, and we hope to really build something substantial with you, with your supporters. I got to give a shout out to your fans and your supporters. I'm looking at Australia, Argentina. They're sending a whole lot of love this way. But we appreciate them. We hope that you maintain a level of safety and health. And please let us know if we can be a resource to you as well.
Thank you so much, Dr. Gore. I won't take up too much more of your time, but I know I'm even seeing people write down saying, I want to give a donation. I'm sending love. So this is the time when you know that the outreach from around the world is here to help, and in any way that they can, big or small, love, money, whatever it is, just the support is coming your way. So I'm gonna let you go so that you can sleep. Keeping on the line. I know you need your sleep. But thank you again so much. It's an honor to speak with you, and I look forward to again soon. And everyone out there, please, please, please support Dr. Gore. Thank you so much for joining us.
Thank you so much. You guys be safe out there.
You too. Stay safe. All right, guys. Well, thank you so much for tuning in to the live. Again, sorry for the mishap earlier. But Dr. Gore's initiative, KAVI, is just one of the many important COVID relief projects that Go Campaign is supporting around the world. Viewers can go to gocampaign.org to learn more and to donate. Even the small amount of money can help, as you know, as Dr. Gore said. And for just a couple of dollars, you can provide masks and soap or a healthy snack for kids who are hungry. You guys can help from home, just like I did, by going to www.gocampaign.org. Thank you guys so much for watching and listening. I'm so honored to be an ambassador for Go Campaign to help support all the incredible work that they're doing around the world, and to watch all you guys messaging in during this with your support and love for Dr. Gore and the work that he's doing and for Go Campaign and just for each other is so inspiring and really quite remarkable. So I hope you guys have a good rest of your day. I know some of you are going to sleep, or you should have been asleep already, so thank you for tuning in, and please keep staying safe and healthy, and more to come. Bye guys.